Today we will discuss Adamanitoma, but really quickly. Are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Adamanitoma is a rare type of bone cancer that usually affects the long bones, especially the tibia, which is the shin bone. It often starts in young adults and can be slow growing. Key points. Symptoms. You might experience pain and swelling in the affected area. Sometimes there can be a noticeable lump. Diagnosis. To find out if you have it, doctors typically use X-rays to look for unusual changes in the bone, MRI or CT scans to get more detailed images, biopsy, removing a small piece of tissue for testing, can confirm the diagnosis. If you have persistent pain or swelling in your bones, it's essential to consult a healthcare professional for proper evaluation. If someone has this condition, here's a simple plan to follow. See a doctor, get a referral to an orthopedic specialist or oncologist, get diagnosed, undergo tests such as X-rays, MRIs, or a biopsy, discuss treatment options including surgery, which is often the main treatment to remove the tumor, or follow-up care such as regular checkups to monitor for any changes. Pain management. Talk to the doctor about ways to manage pain. Support. Consider joining support groups or talking to a counselor for emotional help. In the hospital, the medical team will assess the condition. They will review symptoms and test results, plan surgery, schedule it to remove the tumor from the bone, perform surgery, remove the tumor, and if needed, some surrounding healthy tissue, rebuild bone by using grafts or implants if necessary to support the bone, provide pain relief, give medication to help manage pain after surgery. Follow-up care, arrange for regular checkups to monitor recovery and check for any signs of recurrence. The goal is to remove the cancer and help the person heal. For Adamanitoma, the treatment mainly involves surgery, but meds may be used for pain management, or if there are complications. Here are some common types of meds. Pain relievers, acetaminophen, which is Tylenol, non-steroidal anti-inflammatory drugs or NSAIDs, and these can be ibuprofen, brand name Advil or Motrin, or naproxen, brand name Aleve. Chemotherapy. Sometimes this is used if the cancer is aggressive or it has spread. Doxorubicin, adriamycin, brand name, or methotrexate are both chemotherapy drugs. Bone health medications to support bone health after surgery, such as bisphosphonates like alendronate. And just to point that bisphosphonates are also used for menopausal women who are experiencing bone loss. Always consult with a healthcare professional for specific treatment options tailored to individual cases. People at an increased risk of developing this condition include young adults, typically affects people between 10 and 30 years of age. Males are more likely to get it. Those with a previous bone injury. If you've had injuries or surgeries on your bones, you may have a slightly higher risk. Certain bone disorders, the ones that affect bone growth, would cause you to be at a higher risk. If you fall into one of these groups, it's good to stay aware of any unusual symptoms and consult a doctor if needed. Now you need to watch the next video on rhabdomyolysis or have a look at pneumonia.